The concept that the more care you give or the more things you do to a patient being better is flawed. And I think cardiac telemetry is a perfect example. Telemetry, or monitoring the heart rhythm, has been around for a long time, and we want to detect life-threatening arrhythmias very early because these have to be treated immediately. The notion that this provided a safety net, if you will, has grown to the point that often most patients in the hospitals are on telemetry, even though they're not in a high-risk group. Everyone thought that telemetry couldn't really hurt things, and it could only provide some help. Our nursing colleagues immediately pointed out numerous risks to the patient, patients tripping on the wires, being interrupted from sleep, having wires come off in the middle of the night and having to be woken up, become unstable because of the weight of the telemetry pack, etc. Nurses would tell us that they couldn't give medicines for one patient in the morning without getting interrupted once or twice. Less than 1% of the alarms were actually relatively important clinical calls. There are published guidelines of how long people need to be on telemetry if they have high-risk situations, and they're actually very, very short. Now, our proposal was that we apply the guidelines to all of our patients. This led to an automatic cancellation probably in 95% of the cases, and only in a small number were further discussions necessary. If the nurse was uncomfortable, the automatic discontinuation was canceled and further discussion with the physicians took place. And when we finally did roll it out, we had a fairly abrupt drop in telemetry. The orders being placed dropped by about 40% overnight. And because we had a shortened duration, the average number of patients on telemetry dropped by 70%. When our manuscript describing our results was published in JAMA Internal Medicine recently, it really resonated across the country. It's important to note that what we did was very simple. It was not brain surgery, so to speak. We just took guidelines that have been published for 10 years, written by the most knowledgeable people in the country, and applied them. Medical colleagues, our nursing colleagues, our technical colleagues, they said, if that's what the evidence shows, we're in. When we coupled that with the fact that this is better for patient satisfaction and the patient experience, then people were doubly enthused about it. The magic of Christiana is that we had a group of people who came from a number of different disciplines and worked closely together to make it happen in a way that would be, I think, very difficult in many medical communities and cultures around the country.